So in regards to thyroid, there are fortunately some people out there that have hyper and hypothyroidism. Hyperthyroidism is where you have an overactive thyroid gland. It produces a hormone called T4, but it produces at way accelerated high levels that kind of shuts down the TSH, which is thyroid stimulating hormone, production in the brain. So you see a low TSH and a high T4. These people exhibit hyperactivity type issues. They can have significant weight loss because they're not able to store any fat. They can even burn excess muscle mass. Hypothyroidism, which is what you see most commonly, is an underactive thyroid, where the thyroid doesn't make a lot of T4. So the TSH that comes from the pituitary gland in the brain, the thyroid stimulating hormone, goes down to stimulate the thyroid hormone to make T4. Well, because it's not making it, the TSH, your brain just keeps pumping more TSH, kind of like kicking a dead horse. So in hyperthyroidism patients, you see elevated TSH levels and low T4, the exact opposite of hyperthyroidism. But for most of us, unfortunately, we don't have hyper or hypothyroidism. But what does happen to us as we age is, yeah, your TSH will function normally going from your brain to your thyroid gland, and your thyroid gland will respond to that thyroid stimulating hormone by making T4. But that's not where the story ends. T4 then goes out to every cell in the body and gets converted to another hormone called T3. Now, most doctors measure TSH and T4. Very few measure free T3 values. And it's free T3 is where the money is, so to speak. It's T3 that gives us tons of energy. It's T3 that makes us mentally alert and sharp. It's T3 that burns fat, controls your cholesterol and triglycerides. And the issue here is, as we age, even though your TSH and T4 will remain normal, your ability to convert T4 into T3 goes down as you age. Because, again, your DNA, which makes enzymes, doesn't make this enzyme anymore. It doesn't code for this enzyme to turn your T4 to T3. So even though your T4 remain normal your entire life, your T3 level is just going to drop and drop and drop. Now again, your T3 level may be at normal levels, but it's going to be at the low end of the normal range. And when it comes to thyroid, it's a good time to bring up, is normal a good thing? A lot of us go to our doctors with complaints of weight gain, fatigue, we're losing our hair, our fingernails are brittle and cracked, we're cold all the time, but yet your doctor tells you your thyroid is normal. Well, is normal a good thing? As I tell my patients, you could have a normal IQ, but be 2 points away from being mentally retarded. That's a technical term. So you don't want to be normal, you want to be optimal. When were we optimal? We were optimal in our 20s. Our hormone levels were optimal when we were in our 20s. So even though you may have a normal thyroid hormone, you might even have a normal T3 levels, it may not be optimal enough for you to function at your best. I take compounded thyroid hormone every day. I take it twice a day. Been doing it religiously for 18 years. Again, I have tons of energy. I burn fat. My triglyceride levels are 55. So I do very well. I think very sharp. I have 3 medical offices. I'm able to go to graduate school at the same time. My wife is also 57. She's busy running my medical practice, but she's now getting her PhD in psychology. So she's also very active, very alert, and very sharp. So we're actually increasing as we age, thanks to thyroid not decreasing.